Hello, everyone, and good evening. We still have quite a few folks kind of calling in here. The voice coming out to you is Sahara Suval. I work with the North Central Accountable Community of Health, and we'll be leading tonight's webinar. We're gonna give it, it's 4:30. I'll go ahead and start my video so you can see who's talking to you. And we're gonna go ahead and get started. We're gonna let folks join us. I know that we didn't have registration, so this is kind of an open call, so we'll see kind of who joins us this evening. But you are at the 2020 CHI, which is Coalition for Health Improvement, Community Initiatives Informational Webinar. This is for folks who are interested in learning more about the 2020 CHI Community Initiatives funding opportunity, as well as the application process for this year. So this is the webinar for that. So hopefully you are in the right place. We still have folks kind of coming in here at this point, being kind of this world of Zoom and working remotely. For many of us, I feel like most folks are pretty familiar with Zoom and how it works, but we do have just on the screen here just a quick little overview of the controls. So you have, if you were to hover over the Zoom window, you should have a black toolbar at the bottom that shows you these controls, where you can actually control your own mute and unmute function. You can use your video or not. That's up to you. This is it's an optional to use your video. You can actually see the full list of participants by clicking on the participant list, and you can use the chat box as well to communicate. As you'll see, you should see a little icon that says that we are recording this webinar, and we will make it available on our website later. We'll go ahead and slowly get started. For now, we're gonna ask everyone to stay muted unless you're speaking. My goal is to walk through. I have a lot of information I wanna cover and share. So at the end, we do actually have kind of a blocked out time for a question and answer. So in the meantime though, do feel free to type your name, organization, or group, and where you're calling from into the chat to introduce yourself today. As well as if you have any questions or have any issues, you can flag us in the chat. And I have with me tonight, I have Caroline Tillier and Wendy Bresney, who are my colleagues and who are also serving as chat support this evening. So if you have any issues, you can tuck it into chat and they will actually private message you and hopefully resolve any issues that you may have. With that though, I am gonna go ahead and get started. We have 27 participants and counting. So hopefully we'll have kind of critical mass and keep going. All right, so today we will cover an overview of the funding opportunity, including updates that are new this year. This is the second year that we're actually offering this funding opportunity. So we will talk about a couple updates. We will cover the application submission and review process, right? Kind of why we're all here, including some tips and tricks and some just some things that we've learned running this last year and now offering this year. We'll talk about the scoring criteria for the application, as well as that kind of question and answer session. We will drop in momentarily, there it is, into the chat box. Caroline just dropped in a digital sign-in sheet. If you could go ahead and click that, that will take you to a Google Drive form. And what that's gonna do, if you can fill in that spreadsheet, that's gonna be my sign-in sheet for the day. And then I will send out this webinar and any meeting materials we cover, any follow-up from this meeting, things like that, out to everyone on the sign-in sheet. So if you want to make sure that you are on the list to receive all of the follow-up materials from this meeting, please do click that link in the chat box for the digital sign-in sheet. If you have any issues with the digital sign-in sheet, go ahead and chat into the box, just into the chat box to say I'm having issues with the digital sign-in sheet, and Caroline or Wendy will get back to you and see if we can get you onto the sheet to make sure that you are on the list to receive things if you want them. And just, yep, thank you, Caroline, she's on it. And just as a quick note, everything that we're talking about today can be found on the website, which is ncach.org/chi-funding. It's in the chat box. It's all over all of our application materials as well. So anything that we're talking about today, including this webinar, will be uploaded and placed onto the website. All right, so about this funding. This is a unique funding opportunity that has been made possible by the North Central Accountable Community of Health through a statewide Medicaid transformation project. We are investing in partnerships and capacity to improve rural healthcare across North Central Washington. There are $450,000 available. Our project awards will range from $500 all the way up to $150,000. And like I said, this is not a traditional grant program. This is a rather more of an opportunity for our coalitions for health improvement, which are our kind of community voice groups, come together and really help us decide how to really invest in the health and wellness of our region. And so we offered this opportunity last year, this community investment process. We had 63 applicants, and we were able to award 8 finalists across our 4-county region. So that is Chelan, Douglas, Grant, and Okanogan counties. And we were able to award a range of projects, including things like a mobile food pantry, building local resilience initiatives in Okanogan County, supporting the work of the Grant County Suicide Prevention Task Force, developing a sensory storytime kit and programming for children on the autism spectrum that's actually available through the North Central Regional Library, which I believe has just rebranded to North Central Washington Library, but don't quote me on that. And then the awards for last year's projects ranged from $9,000 to $125,000. So we are casting a pretty wide net here. We're really looking for things that are innovative, collaborative, things that catalyze new efforts or expand current ones. We really are things that are relying on kind of research-based or evidence-based practices, right? Things, we're looking for things that are kind of encouraging new and diverse partnerships, things that impact underserved communities, as well as addressing the social determinants of health, which are things, which are factors that kind of affect our health and well-being overall. So we can think of those things as like where we live and grow and work and play, and all really contribute to whole person health. I have 3 screens I'm working around here, so. All right, so who are the Coalitions for Health Improvement? How did they get this money? And how is this opportunity possible? So the Coalitions for Health Improvement, as I mentioned, are kind of our community voice groups, being the North Central Accountable Community of Health. We are, through a statewide transformation, investing in capacity and partnerships to improve rural health and healthcare across our 4-county region. There are 9 accountable communities of health across our state. We are the North Central one, and we have 3 local coalitions for health improvement who actually organized in 2014 and helped us create the vision and ultimately build the table that brought all of our partners together to form what is now the North Central Accountable Community of Health. They serve as the community voice within our Medicaid transformation efforts, which I apologize for the floating acronyms. I had a 3-letter acronym slide that I pulled last minute. So there are a couple 3-letter acronyms floating in here, and I will do my best to catch them all. So MTP stands for the Medicaid Transformation Project, which is that statewide initiative. Our Coalitions for Health Improvement are networking and action groups that work to identify, inform, and address local health needs across Chelan, Douglas, Grant, and Okanogan counties. There are 3 coalitions across the region. So there's one for Chelan, Douglas, one in Grant County, and one in Okanogan County. Each one of those coalitions actually has a voting seat on our governing board at the Accountable Community of Health. Anyone is welcome to attend coalition meetings or to be a part of the coalitions, but we do have, or the coalitions rather, have a membership charter for anyone who wants to serve as a voting member. And new this year, which is different from last year's funding opportunity, is this year, each coalition locally has the opportunity to manage the funding process and actually make finalist funding recommendations for a portion of the total award funds. Last year, this process was actually managed regionally. So we're very excited to have this happen at a much more hyper-local level and to really have our coalitions take the lead on managing the funding process a little bit more locally, interacting closely with applicants, as well as getting to really make those decisions at the hyper-local level about how they want to invest these funds to improve the health in their county. So the community investment process. I keep saying it's not a traditional grant program. And while we use a lot of the same tools that you use for grants, so we have a project application, things like that. Where this is really different is that applicants will interact with the funders a lot more than what happens in a traditional grant program. So this is really designed to have interaction with the Coalitions for Health Improvement. Both submitted letters of intent and submitted project applications will be reviewed by coalition members locally. If your application is selected for funding, you will be required and expected to share regular updates with the coalitions. Throughout this process, being the application process as well as beyond, we really do encourage all interested applicants and community members to join their local coalitions and also to take an active role in the community investment process yourself. So the funding process, all of the review will happen locally with the coalitions this year. And overall, really, I think one of the biggest things that makes this so unique from other funding opportunities is the opportunity to have a lot of feedback, kind of bi-directional feedback and communication with the funders. So once you submit your letter of intent, it will actually be reviewed by the coalitions, and then you'll have feedback that comes from the coalitions about how they think the project or proposal may be strengthened. It's optional for you to incorporate that feedback, but there is kind of those opportunities along the way for our applicants to really get to hear from and connect with the communities that they're hoping to serve. As far as the proposals, and thank you, Caroline, just tucked into the chat box. If you want to learn more about our funded partners from last year, that information is on the CHI funding website. As for proposals this year, so we are looking for things that address the social determinants of health, right? So those factors that affect our health, such as where a person works, grows, plays, and lives, you know, where we live, how the kind of food we have access to, transportation, our education levels, all of these things actually do have an impact on our health. We're looking for things that build local capacity. There's that, you know, that great saying, if you give a man a fish, he'll eat for a day, but if you teach him to fish, he can eat for a lifetime. So we are looking for proposals that help build local capacity, whether that's, you know, providing technical assistance and training to other partners, whether that's giving, you know, some skills that are maybe usually outsourced, doing some skill building more locally, so that folks who live in the local community have those skills as opposed to outsourcing, or there's a lot of different ways that can look like, but we're looking for things that really help us strengthen our region together. Because this is a community investment process, and this is going to be largely managed by the Coalitions for Health Improvement, we are looking for things that create opportunities for community and or coalition involvement and engagement as appropriate. This looks different depending on the proposal, right? Some proposals are going to be very discrete needs and maybe don't have a lot of, you know, it's a discrete thing for a one-time event, and so there's not a lot of opportunity for ongoing engagement. That's okay, but I think what we're also looking for then is kind of the opportunity to learn from you. So you applied for, you know, you submitted this proposal for this event, you were funded, you had the event. What were your lessons learned? If you could do it again, what would you change? Things like that. If you brought in a trainer for your event, let's say, you know, what were kind of some of the takeaways from that, and how can they be applied in our region or shared with partners across the region? So we're looking for things again that kind of draw back to that building that local capacity. We're looking for things that encourage collaboration, in particular community and clinical partnerships. Our organization is focused on improving health and rural health care delivery. And what we have learned in our work of doing healthcare transformation and improving health is that health and who partners and is responsible for the health of a community, it's actually more than just our clinical partners. It's everybody. Everyone has a role to play. Everyone has ways that they can contribute to the health of their community. So we're really looking for things that highlight creative and out-of-the-box partnerships and really help kind of draw in our community partners into partnerships with clinical partners, so we can make sure that folks are really having their needs and health needs met in a really holistic way. And then things that improve local health outcomes. All right, so who can apply for this funding? This is a quick snapshot. Really, this opportunity is open to anyone in Chelan, Douglas, Grant, or Okanagan counties. Your proposed project must serve and or occur in those places. And we have a pretty wide net that we're throwing out because we know that we have a lot of creative folks that are doing a lot of good work and are already, working collaboratively and innovatively. And so we really wanted to make this as accessible to as wide a swath of our community as we can. There are, as I said earlier, there are some floating acronyms here. So for folks who are already funded partners for our organization that are either part of our whole person care collaborative or our transitional care and diversion intervention work group, that's what those acronyms are floating below. Those folks do have some requirements in order to apply. And if you are a WPCC partner or a TCDI partner and you have more questions about that, feel free to ask me. If neither of those acronyms mean anything to you, that's okay, and that part doesn't apply to you. And note this year, past applicants are eligible to submit proposals, including previously unfunded proposals from 2019. If you were a funded partner from 2019, so one of our 8 finalists, you are able to submit proposals this year, either for a new proposal and completely new project, or for an expansion or enhancement of your currently funded project. But your proposal must demonstrate either an enhancement or expansion in the geographic area served or the population demographics that you serve. So we are open to reconsidering enhancements or expansions of things we've already funded, but it does have to be a very clear, measurable expansion. All right, and I just wanted to take a note on lead applicants versus partners. I got this question last year, so I just threw the slide in this year. So just a note, we encourage partnerships and collaboration. That is one of the things we're really looking for. Competitive applications will, demonstrate collaboration. But there's the lead applicant who will be either the organization or the group who actually submits the application and is responsible for administering funds as well as delivering the reporting requirements. So when you are looking at this application and maybe you're coming together with a group of partners, it's important to identify who that lead applicant is, because that will be the main point of contact with our organization if your proposal is funded, as well as the person who's on deck for making sure that reporting requirements are met for this funding. If you are a partner organization, you play an active and defined role in project implementation. We ask all partners to provide letters of support certifying their role in the project application, as well as our little yellow tip box at the bottom. Competitive applications will clearly describe each partner's role and contribution to the project, as well as how the CHI Community Initiative funding would be used to support project partners. And just a note, if you do have any questions, Wendy on my team is so great and tucked it in, but do feel free to dump them into chat. And then we'll have the Q&A at the very end. Project focus areas. So what kinds of things are we looking for? What kinds of proposals? Similarly to our applicant list, this is pretty broad. These focus areas have been identified by our 3 coalitions for health improvement as the top local health needs from their counties across the region. The projects or submitted proposals can incorporate multiple of these project focus areas or just one, but for every project focus area that is selected in your application, you must demonstrate clearly in your narrative responses how your project will impact, address, and or improve outcomes for those selected project focus areas. We also will accept proposals for focus areas that aren't in the grid above, but we will ask our applicants to clearly articulate justification for their proposed project, or in other words, why is this necessary? Why is this a critical need, or how do you see this as a critical need in your community, and why is it that this funding opportunity is the best fit for it? And I do have a couple questions coming in. I'm gonna save those till the end, but Carwell, we have seen those questions and they will be added to my Q&A. So thank you for chatting those in. All right, project awards available. If you applied last year, this will look a little bit different or this year's will look a little bit different, but our project awards are tiered. There are different requirements for each tier that are outlined in the project application. New this year, we have slightly adjusted the project sizes. Last year, we accepted proposals larger than 150,000, and this year we've actually capped it. So we have 3 tiers this year, being small, medium, and large. I also want, in our little new this year box, we have updated our project application a little bit for folks who applied in 2019 and are now looking at our 2020 application. And we do have a few optional questions for small project applications this year. When you open the application, it's in there in the questions. You'll know whether or not it's an optional question for you. However, for our small project applicants, if you do choose to answer the optional questions, there are some bonus points available for that. And you'll see that in the scoring criteria, which we'll cover a little bit later. And then another thing that's new this year is we've included recognition of organizations or groups who are small or volunteer run and or who are new to grant application. So you'll see in the project application, there are a couple questions around that, and those do actually correlate to not much, but just a few extra points. And the reasoning behind that is that we really wanted to help support folks who may not have the same access to grant resources as other organizations who may be a little bit more experienced with grant applications or actually have professional grant writing staff on their teams. Another thing that is new this year is we are accepting multi-year proposals. Last year we asked for a 1-year max on proposals, but the funding that we're providing is only intended for 1 year. So what that means is that if you want to design and propose a multi-year proposal, the most competitive applications will outline a long-range plan to financially support your project, as well as any other funding sources that you have identified. Our goal here is really to help you launch or expand, but not to provide long-term programmatic or operational support. All right, so here's our priority elements. So this is something that is unique about this funding opportunity is that all of our project applications have a mix and match requirement for these priority elements. They have been selected in hopes of incentivizing projects that are really collaborative, are reaching multiple areas, have cross-sectoral partnerships, or maybe interdisciplinary approaches and how they're approaching different or addressing different health needs through these project focus areas. There are, based on the size of the project that you have, determines how many required priority elements are needed. So for our small projects, we do not require any, but they are encouraged. And for medium, we require at least 2 of the 3. And you, like I said, they're mix and match, so you get to pick them. And then if you are applying for a large project, we will ask you to demonstrate all 3. And the 2020 project application procedures document, which is on our website, and we'll drop a link in a little bit as well, that has more information around the priority elements specifically. If you have any questions about that, though, my contact information is on there and you can absolutely reach out, and I'm happy to walk through this with you. All right, so application submission and review. All right, so this is a lot going on. This is the process for our community investment process. So I just wanted to show all of the different steps that are involved. Many of you who are tuned into this are also members of your local Coalition for Health Improvement, and a lot of this work is going to be happening with the coalitions this year. So this is what that looks like, this community investment process. There we go. But I wanted to call it just a couple things that are new this year. Pardon me. So new this year, we are using SurveyMonkey to host an electronic letter of intent submission. Last year, we asked for a Word or PDF letter that was written out. This year, we're hosting all of it on SurveyMonkey. So when you download the letter of intent guidelines document, and we'll put, there it is, the link is there. That will actually include the link to the SurveyMonkey, so that's the submission form. The submission form will ask you for some additional information, including contact information, your partners, description of your project. And it will also have that submission guidelines document that we just shared. We'll also have all of the questions that we'll be asking you on the letter of intent submission. Because everything is electronic and managed through SurveyMonkey this year, we suggest downloading that letter of intent guidelines document that was just put into the chat box and actually responding to the prompts ahead of time on like a Word document or a notepad or whatever you have on your computer. And then when you are ready to submit, to actually load the SurveyMonkey and paste your answers from that Word document into the questions on SurveyMonkey. And if you run into any issues with SurveyMonkey, we're trying this year. So if you run into any issues with this, again, my contact information is on the form, and we can reach out to me and I will work with you to make sure that we get your LOI. We do not want SurveyMonkey to be a barrier. And the great question, the letter of intent is due September 4th. A few more questions coming in. We will capture those and answer them during the Q&A section. Thank you for your questions. This is the timeline. Like I said, everything is available on our website, ncach.org/CHI-funding, which is kind of a mouthful when you say it. But I wanted to just highlight kind of the two major deadlines, 2 key dates for you. So September 4th is a Friday, and it is when our letters of intent are due. Between September to October, a letter of intent review will happen by the local coalitions for health improvement, and then they will actually determine who is invited forward to submit an application. So new this year is that application submission is by invitation only. So every applicant will be required to submit a letter of intent, and then we will let you know whether or not your LOI submission is eligible to proceed forward and submit a project application. Project applications are going to be due October 9th. Oh, and I didn't include it on here, but your projects can start as early as January 1st of 2021. All right, so this is my PSA and plug, and that is, this is really the thing that makes this process so unique, is that this community investment process, our reviewers and the folks who are helping make these decisions about how we invest these funds to build a healthier region together, will be from the coalitions of health improvement. So we're looking for volunteer reviewers to join our Coalitions for Health Improvement review teams. We just dropped a link in to sign up if you're interested. You can be both an applicant and a reviewer, though I promise you, you will not get to review your own application. And we are this year asking for each coalition to have a minimum of 5 reviewers in order to actually manage that funding process locally. We want to make sure that that capacity is there before we just hand off applications. So we are drumming up folks. We are asking for folks to volunteer and consider being a volunteer reviewer. All training and resources will be provided. It's estimated 6 to 12 hours between September through November. Everything can be done online. And last year we had almost 30 volunteer reviewers who helped make this process possible and really helped us drive towards investing in meaningful projects that are helping advance kind of our vision for whole person health. If you want to learn more about that, or if you want to connect with anyone who was a reviewer last year, I am happy to share more about that offline. And oh, good question. So Marlene, I'll answer that one now. So someone signed up to volunteer, wants to know when will they communicate with reviewers for the first time. That is a great question. Thank you for signing up to volunteer. I will be in touch, I think I'm going to shoot for next week is when I'm going to send kind of a first touch point out to reviewers. So thank you for signing up. That link is there if you're interested in being part of our community investment process as a reviewer. And I will be in touch with folks next week. All right, so applications and scoring criteria. So our applications this year are all going to be handled electronically. They are available in both Word and PDF format on our website. They are due October 9th. We will, in just a moment, I will pull up the scoring criteria and talk about that for just a minute. But this year, there are 100 points total plus just a few bonus points. Last year, we had a lot of bonus points available and we've changed that structure. So you'll see that on the project scoring criteria. For our narrative responses in particular, when you're looking at the application, we're looking for things that are clear and specific. This is a pretty meaty application in terms of funding applications. And where we have not designated any minimum or maximum for word counts, because we want you to have the space that you need to tell us what you need to tell us. But we want things that are clear and specific. We're looking for really strong responses, things that are concise, things that aren't redundant. It can be really frustrating as a reviewer to have the see above. So we've tried to make our questions super specific this year. And so what we're asking for from our applicants is also that your responses are as specific and strong as possible. If you check any information in the project information checkboxes part of the application, which if you haven't seen the application, this may all sound foreign, but if you have seen the application, the front page is a series of checkboxes. For anything that you check about your proposed project, we want to see that reflected in the narrative responses. So if you tell us that your project is going to address ACEs and resiliency, education, and pre or neonatal support in the checkboxes, that in your project plan description in the application, we want to see exactly how your project or your proposed project is going to do those things. We want an accurate budget with expenses clearly outlined and explained, recognizing for some of the larger proposals that that can be, we don't need like down to every cent, but we do want a sense of where and what your anticipated costs are as best you can predict them. And we do include a budget narrative section. So we do, and I'm not going to steal my coworker Tanya's thunder, but I do have someone on who will be sharing a little bit more with us about some more tips and tricks in that regard. And then this year, I think one of the things that we're really, really hoping for is really looking for proposals that align with the values of the community investment process and the Coalitions for Health Improvement. So looking for things that are really encouraging innovation and collaboration and are supporting our social determinants of health and providing opportunities for learning and engagement and really building that capacity locally. With that, I'm going to hand it off to my colleague Tanya Gleason, who was our grants and capacity manager, but now is our opioid project manager. Tanya has over a decade of professional grant writing experience and was a big support for applicants last year. So Tanya will be sharing some specific tips and tricks with us.
Great, thanks, Sahara. So Sahara asked me to give just a little bit of time today to do kind of a mini grant training, and a lot of the things that I'm going to talk about will send out in a bolded form and not only apply to the CHI funding, but grants land at large. One of the things I believe really strongly in, so does the ACH, is that we want to build capacity for people to be able to do the thing. And this is one of many grants out there. And so I'm happy to share a few tips that I've learned along the way that have really helped me in my journey in writing and managing grants. And just as an aside, I'm always willing to help people with, their applications, with questions that they have. And I think Sahara is also going to mention that at the end, but just want to put myself out there. I love grants. I love everything around them. And it can be really challenging to understand the language and to build a really good application, if you're anxious around the process. So I'm hoping to alleviate a little bit of that stress today. And I first wanted to start out by talking about, the RFP, and kind of your very starting point is to familiarize yourself with the goals of the funding. And I can't stress this enough. The more you link the goals of the funding to your project, the more successful that you're going to be, and the higher your score ultimately is going to be from the reviewers. So the funder in this case is the ACH. And I would just encourage you to read all the materials really thoroughly, and just make sure you understand the intent of the funding and what we're looking for in terms of applications. The second piece of advice I have around before you even start writing is identifying if you are grant ready. So a grant readiness assessment can be as small, as asking leadership if you have the systems that are in place, or it can be a full-blown assessment. And I have resources for that too that I'm happy to send along. But basically, it's about assessing whether your organization or your group or coalition has the systems that it needs in order to implement a grant well. So before you even start thinking about writing, before you start writing at all, be thinking about any systems that you have that may need bolstering, That could include creating financial documents, tracking information, evaluation plans. All of that should be kind of should be thought about prior to kind of delving into the application. And it'll make, if you are awarded, doing that work ahead of time is really going to save you a lot of time in the long run and could really allow you to just hit the ground running. So that's kind of before you start writing, before you make this journey towards writing this really wonderful grant application. The second kind of series of tips I want to talk about is around the application itself, and the application not necessarily being the CHI application, but every application that you're going to come into contact with as you write grants. So each section of a grant application tends to build off of the other, the one that came before it. So if you keep that in mind, it will really keep you from being redundant, and we've talked about that a little bit here. What you want to make it easy to do is for the viewer to find the answer to the question. And from beginning to end, your grant application should tell a story. And in a story, you have very specific pieces that say a specific thing. So in each of the questions, just answer the question that's in that box. And if you do that for each section, the end result is going to be a longer form story. And it's going to be easier for the reviewer to see that you've done your due diligence, that you've read the application, and it's going to be really cut and dry in that way. That said, I just want, if we were to put that into a soundbite, it would be, don't make the reviewer hunt for your answers. Make them really clear, make them really concrete, provide evidence for the need. You start out with a strong foundation of research. Research is always appreciated, acceptable, and desired. And hard data is always wonderful to put in your applications. Well, you can also put in that qualitative data too, in conjunction with that, with your anecdotal information. That can be patient stories, client stories, anything that's a narrative that kind of encircles your hard data and really shows that there's a local need and that you're seeing what that is and that you want to be a part of the solution. That said, in terms of grants, like grantors and funders, they're looking to fund activities, not necessarily ideas. So our ideas are awesome, but they're not really compelling unless you have a series of activities that are gonna show from start to finish how you're gonna be doing this program or project. So be as concrete as possible about what your problem is, what you're gonna do, how you're gonna accomplish it, with what resources, by whom, and in what time frame. So in that, I'd say is about 90% of grant applications. Keep that in your brain and you'll be much more successful. That said, there isn't really a need for flowery or academic language. Tell it like it is. Always just tell it like it is. And finally, when you're writing or you're thinking through your staffing plan, identify the lead and any other key staff as much as possible prior to writing. That's not necessarily to say that you have to have all the plans in place for who's going to be doing what, but it's always helpful to have a basic outline of that while you're writing. And thirdly, I wanted to talk about just a little bit of information around post-grant processes. So they're separated into if you are funded or you aren't funded. And if you are selected for funding, the first thing that you're going to want to do is assemble that kickoff meeting and the team, which includes your implementation lead, key staff, and all that. Come together and create a plan for that grant. The quicker you do that after the award, the better, and you can get going much quicker. That said, if you are not selected for funding, it's really important to remember that this is not a personal affront if a grant project isn't funded. And as someone who's been rejected a lot, in grants land, it's kind of just a part of that world and a part of that life. And it's difficult to not have it be personal because the work that we do is so inherently personal in and of itself. But unfortunately, the climate of grants is extremely competitive, can be extremely competitive. And there's so many wonderful projects and so little funding. You know, 450,000 seems like a lot, but we can't fund everything that we would want. And almost every funder has to deal with that. And I've received so many boilerplate letters, you know, your project was wonderful. However, you know, we can't fund it based on, you know, our funding capacity. So if you aren't funded, there's a couple things that you can really do to kind of bolster your reputation, your org, you know, in the community where you are. And the first thing that you can do is reach out to the funder and really ask the honest question of what you can do to improve your application based on the feedback that your reviewers gave. That said, that isn't the only factor that comes into funding. There's so many other factors that, you know, come into, like that, you know, capacity piece and the lack of funding. But at the very least, if you want to do better and be better and learn about your own grants and your writing and what you could be doing better, funders, not just NCACH, but all funders generally, will answer those questions very honestly, and they want people to succeed. So never be afraid to reach out, and that's through the whole process, from beginning to end. Most funders are willing to walk you through what they are looking in terms of priorities and maybe improvements to applications in the future. And that leads me to kind of the relationship piece and that cultivation. The cultivation of that relationship matters at every step of the way, and that includes if you're not funded. That relationship does not stop if you are not awarded funding. And institutional memory is really long, and you know, sometimes in small towns it's even longer. So, you know, the proposal itself is just one part of building, you know, credibility and relationships. The grants land is, in theory, much larger than that. The proposal is one piece of that. It's where you show what your organization is and what it can do. But every communication you have with the funder is equally important. And in order to open up that meaningful dialogue, you have to be willing to build that relationship and really continue to do that even post-award, post not being awarded, so that that relationship actually results in one of mutual respect or information. If, you know, the funder didn't realize what you did fully before, maybe they do now, and they see you and they have name recognition. And if that's one thing, if you remember anything about this process, is that relationships matter 100%. And that's a real quick and dirty grant training. I know that's a lot of information, but we can send this out so you just have it bullet by bullet. If you abide by these small things, I guarantee you your grants are going to go farther and you're going to get more acceptances. And ultimately, we want people to succeed in our community. We want more funding to come here. So that's why we wanted to give you kind of this leg up and make sure that some of the questions that you might be feeling or thinking about, or the stress you might be feeling around this application or others, it's really just about telling the story, and funders want to hear the story. So just think about that. And I'm hoping that I was able to alleviate a little bit of anxiety, provide some new information or even a refresher with this information. So thank you very much for letting me take some time in your meeting today. And I think Sahara put my contact information in the box here. Yes. So please reach out to me if you need.
Yeah. Thank you so much, Tanya. We so appreciate you taking the time and sharing some of your expertise with us. So Tanya is available to help support applicants this year with your application questions. She is not available to write your grant. I want to say that, but Tanya last year did a lot of work one-on-one with our applicants and is willing to, as they have capacity, to answer phone calls and have some one-on-ones with folks if you have specific questions about your application moving forward. Part of this building capacity goal that we have through the community initiatives process is not just through the proposals that we receive, but also we are hoping that by having such an open and kind of transparent process, that we together as a region can strengthen our ability to go for that funding, as Tanya said. I'm going to, with that though, how do we make our determinations about successful and competitive applications? So I have just put into the screen the project application and submission procedures. Caroline did put that link in there. It's on the website. There we go. I just tucked it into chat as well, so you can follow along on your own or with me. I'm not going to spend too much time on this, but I want to just show this as a resource and just let you know that if you have a question about your application or this process, it is likely in this packet. And what I want to show you is starting on page 8, if it will load. Oh, it doesn't want to load right now. So starting on page 8 is the scoring criteria. If you give me just a second here. I don't know why I had my PDF all preloaded. If you give me just a moment, I'm going to try and reopen it and show you the scoring criteria. So there are 2 scoring criteria, and of course the first one I grab is the small. So when you look at the procedure packet, that link that we just put into chat, you start on page 8, so don't get hung up on the project or the page numbers on this document. We include the scoring criteria for both small project applications as well as medium and large project applications. And the reason why I want to show you this is how we are assigning points for your responses. So please use this as a reference and a guide when you are creating your content for your grant application, and when you're doing that final review before you submit it to us. This is the template that we will be using to score applications. So you can see on the column on the left-hand side, it shows for all of our questions that we ask you, we have all of the available points for those responses. So thinking about, if you see something that's worth 10 points, that's kind of a weightier question. So making sure that that response has all of the elements that we've outlined here. And I won't scroll too long, but the other thing that I want to share with the scoring criteria is we also offer a kind of overall reviewer impression. So when you are looking at this, you'll notice that your content is worth about 90 points up to, and then we have this overall reviewer impression score, and this was designed to really help our reviewers who may also be applicants, who are community members, who may be coming into contact with these projects once they're funded and live, to really help kind of share their context as a reviewer. So there's 10 points available there, and then there's 90 points available for the rest of the criteria. And I'm going to close this document, but it is available in that PDF packet with the link that we just shared. And I just want to call out that there are 2 scoring criteria documents, again, one for small projects and one for medium and large. So make sure that you're looking at the right criteria depending on the size of application that you're submitting, because that will make a difference for you. All right, so now we're at the Q&A session. So what I'm going to do is I'm going to start with, if I can grab it, questions that have been chatted in, and we have a document that I'm going to open. So I will start answering questions that have been chatted in along the way. And then if there are any other questions, you can also unmute yourself and chime them in. So let me start with the questions that have been chatted in, and then we'll open it up for any other questions. So question 1, can we submit more than one application? If so, do you prefer them in one package or separately? You can submit more than one application for separate proposals. They can be different sizes. I think I would prefer that they get submitted as like one total application per proposal. So keep them separate, because I would have concerns that documents could get mixed up otherwise. So I would say if you are submitting more than one proposal, to do that separately. And then if your LOI submission is then invited to project application, and let's say both of your LOIs get invited to project application, when you email them back to me, I would appreciate it if it was separate emails, to make sure that there's no way that I can get wires crossed when I'm then doing all the back end coordinating. So yes, you can submit more than one. Please submit them separately. Do you fund planning efforts for a project that fills the requirements? Is a question that was typed in. Could I ask whoever typed that question in, if you have the ability to unmute, to explain what you mean by that question? I want to make sure I'm actually answering your question.
Hi, Sahara. This is Carol Bell, and yes, it was me who sent that. And so the idea that we have is pretty substantial, and it meets all of your large requirements. And it's kind of like it would have a huge impact. And I'm being a little cagey because we kind of want to keep it to ourselves until we go. And so it would involve multiple partners, it would involve multiple counties, but it is sufficiently large enough that in order to make it work, there's a lot of research that needs to be done, and the end result would be a plan that could be used going forward by all the partners, but also as an example for the community health initiative projects in general, as a sort of a model.
Absolutely. Okay, I understand your question, and I'm excited to see what we get. Yes, so you can build in. We will fund planning efforts. So if your proposal is a large, countywide, multi-county, we're launching a coalition, we want to build we want to build up skills or whatnot, we need to have 3 months of planning to get to implementation. Build that into your project plan. We want to know it. We don't want to be surprised by that. But as long as you can outline in your project implementation plan, from month Y to month Z, we're going to be planning. And so part of the funding we're requesting is for staff time to make sure that these coordinated activities are happening. We do consider proposals with that. And one of the actually, several of our larger projects that were funded last year did include funding for staff positions.
Okay, so I just want to clarify, if the project were large enough that the ask is going to be, it could still qualify as medium or large, but it would just be for the planning and development of a model, and then for which someone could later request funding, and we probably would it, or does it have to include an actual implementation of the program as well?
I think we are looking for things that are closer to shovel ready than not. I think what we're hoping is to invest in things that are able to be used or applied. Now, that said, though, things like skill building, that is absolutely, it's hard to quantify, but that does have a value and an impact. So maybe we can meet offline for some more specific questions about your proposal specifically.
Okay.
Okay.
Great. Thanks, Sahara.
Yeah. All right. A few more questions. If the project requires transportation, would a vehicle be an eligible purchase? What about staff positions? So I answered this in the other question. Yes, we will. This funding can be for staff positions. What we don't want to do, though, is to just offer kind of gaps in programmatic support. We recognize, for example, this year, the coronavirus pandemic has impacted everyone in ways that we didn't quite expect, and so there are we don't want to fill gaps that are holes that were created in the past. And we're not trying to just like keep you going along for one more year. What we're really trying to do is help launch things that are new that you wouldn't have been able to do without this funding, or to expand and enhance things that wouldn't have been able to been expanded or enhanced without this funding. So we will pay for staff positions, but they have to be attached to, you know, this is the new thing or the expanded thing that's coming with that staff time. Same with the vehicle. Absolutely, we will, if your project requires transportation, we will help fund vehicles. In fact, one of our funded projects from last year, they had to, because of the coronavirus pandemic, they actually had to change their model from their original project plan. And we've actually worked with them, and they have transitioned their model from an in-person service delivery model to a mobile service delivery model. And so we actually approved them transitioning some of their awarded funds from staff time to purchasing a van so that they could be mobile. So we want to work with you too in that regard. But yes, a vehicle would be an eligible purchase, but we will ask for a stewardship plan. Oh, and it looks like we are at 5:30. So if you have a few more minutes to hang on with me, please do. Otherwise, all of this will be sent out at the end. So if you've got to go now, we thank you so much for spending your time with us. If you have a few more minutes, I'll keep answering more questions. All right. Someone says, assume the budget narrative is a good place to explain unusual circumstances around COVID-19 and effect on our organization. Yes, and there are a few other places in the project application. I won't pull it up now, but this year we have added, because of just all of the unexpected things that have come about from the coronavirus pandemic, we have added a few questions specifically in the project description around some COVID considerations, as well as, yeah, I would say if you, as specific as you can get in the budget narrative, the better. And Tanya and I are both around to help support applicants in what that specificity can look like. Are you capping the number of applications that are invited, or is it based on quality? We are not capping the number of applications that are invited, and we are hoping for quality applications. I would say for folks who are looking at this funding opportunity, we're really hoping for things that are going to kind of build and improve the health of the region long term. So we want things that contribute to a healthier, a healthier North Central Washington. And so when you're thinking about different funding opportunities and you're just looking for like something to, get that final 10K so you can launch X, this may not be the best fit in terms of funding opportunities for that. So we're not capping number of applications, but we are really hoping to invest in a series of projects that are going to improve the health of the region and really build capacity locally long term. All right, I think I've captured all of the questions that have come in. Are there any other questions that I can answer? All right, I'm assuming I've answered every question that you may have. No, as I rip out my headphones for a dramatic finish. This is, I guess I've just popped up my contact information. Please do feel free to reach out. We're at the end. Thank you so much for your time this evening. We really appreciate all of your interest in this. And as we said, letters of intent are due September 4th. So we hope to see some proposals from you. If you do have questions or want some more support, feel free to reach out. There's my phone number and email, and happy to connect with you. So thank you everyone for your time this evening.
Thank you.
Thanks, everyone.
All right, take care, everybody.